Welcome to the Low Carb Conferences podcast. I'm your host, Dr. Jeff Gerber, and our special guest today is Dr. Chris Palmer, and he'll be speaking at our event in February 2023. So how are you today, Chris?
I'm doing great. Thank you.
Hey, it's great to have you aboard. So Dr. Palmer is a Harvard Medical School physician and psychiatrist, a professor, a well-published researcher, clinician, educator, and has served in many leadership roles. He's also an author with his new book, Brain Energy, that's coming out this fall. He's affiliated with McLean Hospital, Massachusetts General Hospital, and Harvard Medical School. So, Chris, if you can give us a little more background, tell us about your professional interests and how you became interested in using nutrition as a tool to address mental illness.
Sure. So I'm at one of the largest psychiatric hospitals in the Harvard Medical School system. And, for a little over 20 years now, I've been the director of continuing education here. So on one hand, I am in a very kind of highly esteemed / conservative mental health organization and represent kind of the state of the art in the mental health field. For over 15 years, I did neuroscience research in the fields of addiction and sleep. Through all of that, I've always maintained a clinical practice. Typically my clinical practice is composed of treatment-resistant patients. So people who have been to lots of other mental health professionals, psychiatrists in and out of hospitals, usually have tried lots of medications and, years or decades of psychotherapy, nothing's working for them, and then they come to me. And then I'm supposed to try to do something for them. So that's my kind of day job. And then, the way that I came into using nutrition, really, the quick story is that it starts with my own journey. Like over 20 years ago, I was, religiously following a low-fat diet, exercising regularly, and already in my 20s, I had metabolic syndrome. I decided to try a low-carb ketogenic diet at that time called the Atkins diet, and lo and behold, it reversed my metabolic syndrome. But the thing that I noticed was that it also resulted in profound effects in mood, concentration, energy, and sleep. My sleep was much better. And these were dramatic changes for me. And I had never really felt that way in my entire life. And so I started recommending the diet to friends and family. Many of them were noticing similar improvements. And so within a couple of years, I started using it in patients with treatment-resistant depression. And lo and behold, it was working for at least some of them. But for the most part, because the Atkins diet at that point was so highly controversial, we didn't have as much research published in the medical literature at that point. I really kind of stayed quiet about it. I wasn't really talking about it, wasn't publishing anything about it. Just trying to help the patients in front of me. And, my career in many ways took a dramatic turn in 2016 when one of my patients for over 8 years with schizoaffective disorder asked for my help to lose weight. And, even though I'd been using ketogenic diets for depression and schizophrenia are very different disorders. So I had no hope or no expectation that this was really going to do anything for his psychiatric symptoms. I was simply trying to help him lose weight. And within 2 weeks, not only did he begin losing weight, but I noticed dramatic changes in his level of depression and alertness. He was making better eye contact, talking more. And I thought, well, isn't that interesting? Here's that antidepressant effect that I've seen in other people. And wow, it's kind of doing the same thing for him. But at that point, he was still having hallucinations and delusions. The shocking thing to me was that about 6 to 8 weeks into it, he spontaneously started reporting that his hallucinations were going away and that his long-standing paranoid delusions were also going away. He began to realize that they weren't true and probably never had been. And, initially I was dumbfounded. I really was. I had no expectation that it would do anything. And this went against everything that I knew about schizophrenia. Schizophrenia doesn't go into remission. It does not get that dramatically better with any of the best treatments that we have to offer. Clozapine, other antipsychotics, even shock treatments. I've seen dozens and dozens of patients get all of those treatments, and I've never seen such dramatic improvement in symptoms. And so I went on a kind of scientific search to try to understand, what am I seeing? Like, how can I understand this? And although I knew about the ketogenic diet as a weight loss intervention and its use in type 2 diabetes, at that point in time, I didn't know that it was used as an epilepsy treatment and that it was actually an evidence-based 100-year-old epilepsy treatment. And that was particularly relevant to me as a psychiatrist because we use epilepsy treatments in psychiatry all the time in millions of people. Medications like Depakote, Tegretol, Lamictal, Valium, Klonopin, Xanax, Neurontin, all of those are epilepsy treatments. But in fact, most people who've heard of those names know them from their use in mental health patients, not in epilepsy patients, because mental health conditions are much, much more common than epilepsy is. And with that, I ended up doing a deeper dive into the neuroscience. Like, do they actually understand how this diet stops seizures? And in fact, we do. We've got a lot of basic neuroscience research documenting the effects of this diet on the brain, neurotransmitter systems, brain inflammation, all sorts of things. And many of those mechanisms of action are known to be relevant to patients with serious mental illness. I didn't stop there. So that started me on a path to using this in dozens of patients. I've been collaborating with researchers and clinicians from around the world. Clinical trials are underway now. We have, a very generous family, the Bazuki family, that is funding lots of research in this area. So things have really taken off, but I didn't stop there. Because again, this flies in the face of everything I've been taught as a psychiatrist. Schizophrenia. Oh, go ahead.
Yeah, no, man, that was packed, loaded with all kinds of information, Chris.
Sorry.
I love it. So first I have to commend you in terms of bringing this into your clinical practice and dealing with patients in this way, especially, working at the university. And I think they've already recognized what you do, and they acknowledge that you're approaching these conditions with dietary treatment.
Yes, so that's one of, it's interesting because a lot of people in the low carb and keto community do not like Harvard. They hear about the Harvard School of Public Health and how the researchers there shun the ketogenic diet and low carb diets. But I just want to say, for the record, Harvard is a really big place, and there are thousands and thousands of clinicians and researchers there with a broad range of opinions on nutrition and other matters. So my hospital has been extraordinarily supportive of these efforts, and so it's been great.
Yeah, so the idea is that Harvard, we look at them as the medical authority, but the idea is that, as you said, there's all kinds of different thought processes going on, and the hope is that there's people like you that are kind of open to new ideas and thinking outside the box. And to your credit, it's fantastic, and it's kind of frustrating that we as healthcare professionals had to learn about nutrition through our own personal experiences. And it's the same experience for me. I had gone through this learning process and then started applying this to the patients. Now, your fantastic experience back in 2016 with the one patient, you call that a case study, and then you now apply it to your patient population, and you have case after case after case where you show that there's an improvement or benefit. Some might even say, well, they're anecdotes, but we have healthcare professionals watching over, so perhaps they're case studies. And so the next step, of course, is to turn this into academic research. And you mentioned that you have a philanthropy that's helping you with that. And I'd like to ask more about what is in the future in terms of researching the use of ketogenic diets in mental health.
So this is a burgeoning new area in the mental health field. People are extraordinarily excited about it. So we've got at least 5 controlled trials underway of the ketogenic diet for bipolar disorder or schizophrenia. There's another trial getting started. There's one trial getting wrapped up actually in the UK of ketogenic diet for depression. Another one about to start under the kind of guidance and authority of Jeff Volek. But it's not limited to just people in low carb keto communities. So there's an overwhelming amount of evidence about metabolic mitochondrial disturbances in people with mental illness. And those researchers have been doing this research for decades. And as soon as I point out this is a metabolic treatment, I don't talk about it as a diet. I talk about it as a metabolic intervention or a metabolic therapy that improves metabolism. That gets them excited about it. And then we've got, we've got the whole field of neurology and epilepsy, and a lot of those researchers are very interested and passionate about seeing this because there's so much overlap between epilepsy and mental health. And everybody knows it, and anybody who works in either field knows there's a tremendous amount of overlap between those fields, not just in terms of the treatments that we use, but also in terms of comorbidity and the symptoms that we see. And, to much people's surprise, probably the National Institutes of Health has already done one study of the ketogenic diet for alcohol use disorder. That's the new label for alcoholism. And we have one positive trial that the ketogenic diet can be a powerful and effective treatment for people with alcohol use disorder. It can decrease withdrawal symptoms. It can decrease cravings for alcohol. It can improve brain metabolism and decrease brain inflammation, all things that are really helpful and powerful in helping people recover from alcoholism. And they are now launching a multi-million-dollar trial. So people in the mental health field are desperate for better answers than what we are giving patients today. Mental disorders are the leading cause of disability on the planet because our treatments just don't work for so many people. And so I think that a lot of mental health professionals, neuroscientists, and others are really excited about this.
Well, we're great to see that there's an influx of philanthropy and money to fund this research. And, there's so many mechanisms that we can talk about. But I do agree, that the pandemic, I mean, especially as a primary care doctor, we've just seen how devastating it's been both emotionally, financially, and on the health side of things. And so we all need to pull up on our bootstraps and get things back in order and get our patients going in the right direction. And so, I kind of joke with the mental health professionals that in recent years, business is booming.
Yeah.
So, this is great that we have another, alternative treatments to medication. And, my wife is in a book group, and there is a book I don't know if you're familiar. It's called Hidden Valley Road, and it's from a family in Colorado Springs. It was back in the 60s and 70s, and they had 12 children. 6 of them had schizophrenia, if you're familiar with the story. And that was some of the ammunition that led to the conclusions that mental illness is a genetic disorder. And I know you have a lot to disagree on that with.
I do. It's so there's no doubt that mental illnesses run in families. That has been known for centuries, actually. Interestingly, mental illness runs in the same families that type 2 diabetes runs in. And we know that type 2 diabetes runs in families. We know that obesity runs in families. And we know that cardiovascular disease runs in families. And yet, most people today, just human beings, but also researchers and clinicians, understand the primary cause of obesity is not in our genes. The primary cause of type 2 diabetes is not in our genes. And the primary cause of cardiovascular disease is not either. Now, yes, there are some rare genetic disorders that confer high levels of risk for all of those things. And likewise, there can be some rare genetic disorders that confer high levels of risk for mental disorders. But by and large, even though those disorders run in families, they are largely considered to be determined primarily by environment. And, you know, researchers have been struggling this for over 2 decades now, because when we mapped the human genome, the medical community was filled with hope. We were going to find the gene for type 2 diabetes, and we were going to find the gene for obesity, and we were going to find the gene for schizophrenia and bipolar disorder and major depression. And once we identified the genes, we would be able to figure out what those genes were doing, and then we would be able to solve all of these illnesses. And it's just not so. We've had 20 years to do this work. Trust me, they have put AI on this task. AI says there's nothing there, folks. There's nothing to see here. AI has analyzed the human genome up and down. The primary answer does not lie in genetics. That doesn't take away from the fact that these disorders run in families. And so we have to somehow reconcile that fact. Obesity does run in families, and it's not just upbringing. Everybody thinks it's upbringing, but if an obese woman has an infant and gives that infant up for adoption to a lean, fit family, that child still has a dramatically elevated risk of developing obesity, just because of the fact that that infant's biological mother was obese, and in particular was obese at the time that she had that child. And so there's something being transmitted. And again, up until recently, everybody assumed it was genes, but it's not. It's epigenetic signaling factors. And it's the womb environment and all sorts of other things that do change the expression of genes, and that does confer risk over long periods of time. But the good news is that, you know, genetics can't be changed, and people are working on it, and they're working on gene therapies that will change your defective genes into non-defective ones, or at least replace, you know, those. But the good news is that we don't need gene therapy to cure or heal schizophrenia or bipolar disorder, because it's not in the genes, it's in epigenetics. And epigenetics can be changed through environment, like diet and exercise and lots of other things.
Yeah, so epigenetics, the expression of the gene, but this is really the argument of nature versus nurture. And so, I think you and I and other healthcare professionals are realizing that the shift really comes to the nurturing part, and the environment in which we live. And we can't really be blaming genetics, and they can't be changed much anyway. And look, when we see 2/3 of the population have an insulin resistance problem or a problem with weight in the last 4 or 5 decades, you can't really blame genetics for that at all. So
you can't. And so you brought up insulin resistance, and so if I can insert one really cool, interesting study that starts to tie some of this together. Some researchers actually followed 5,000 children from the ages of 1 to 24. The kids who had the highest levels of insulin resistance beginning at age 9 were 3 times more likely to already be diagnosed with bipolar disorder or schizophrenia by the time they turned 24. And they were 5 times more likely to be at risk for developing schizophrenia or bipolar disorder, meaning that although some of them were not officially diagnosed, they were showing worrisome signs and symptoms. So a 5-fold increase, that's 500% increase. That is huge. Right now, we don't have any biomarkers other than something like that can predict whether somebody is going to go on to develop bipolar disorder or schizophrenia. So although most people, might hear me saying stuff and thinking, well, schizophrenia, that has nothing to do with diet, or that has nothing to do with insulin resistance. Actually, it really does.
So, yeah, so just, that's an association studies that you're reporting. But the thing is, an association is really significant when it's over 2x, and you're saying it's 5x. I didn't know this information, but oh my God, this, we really need to be addressing the insulin resistance and the metabolic syndrome. And so we'll dive into why the diet works. But just to back up and review some of the mechanisms that you have mentioned. And the first thing is, food addiction, the reward centers of the brain, and the idea that, we've now manufactured food to trigger the reward centers. And this is really problematic, number one. Also, I understand, looking at like seizures disorders, that the problem is with excitation of the neurochemicals, and where we're looking at the connections of the neurons in the brain. And so the idea is, can we affect that in a positive way, say through a ketogenic diet, and why might that work? And the other aspect is that traditionally we've thought of glucose as being the only fuel for the brain. Fat per se doesn't necessarily get metabolized by the brain, but then this discovery that ketone bodies, beta hydroxybutyrate can be the other fuel for the brain. And the idea in the research is that when you switch the fuel over to ketones, it stabilizes everything. So look, you're the expert, and maybe you can add to that.
Yeah. So you mentioned a lot. So there's a ton to unpack and even more to add. But I would say that in terms of its anti-seizure effect, there are, the ketogenic diet is known to affect at least 3 different neurotransmitter systems. Those are GABA, glutamate, and adenosine. And, a lot of people talk about seizures as an imbalance of GABA and glutamate activity. Glutamate is an excitatory neurotransmitter, and GABA is an inhibitory neurotransmitter. And the assumption is that, well, if the brain is seizing, then it must have too much of the excitatory stuff and or not enough of the inhibitory stuff. It really is that simple. I mean, this imbalance of those neurotransmitters actually hasn't really been clearly shown, and it would change on a regular basis. But we do have evidence that ketone bodies themselves, actually a study just came out a couple of weeks ago, showing that administering exogenous beta hydroxybutyrate to people not on a ketogenic diet influences brain function and brain neurotransmitters, and specifically glutamate and GABA activity in specific brain regions. So we know that that is probably playing a role. The ketogenic diet also influences calcium channel and calcium signaling, which is a really important kind of on-off switch in brain cells. And as I mentioned before, it decreases brain inflammation, and everybody knows brain inflammation is bad. So decreasing it must be good. And sure enough, ketogenic diet has been shown to do that. The study with people with alcohol use disorder actually showed that it decreased brain inflammation in those patients. You know, there's a lot of competition in terms of what is the mechanism of action. So ketone bodies themselves are an alternate fuel source, as you mentioned. So instead of, if your cells have trouble using glucose, then give them ketones. And maybe that will be an easier fuel source for them to use. And sure enough, that does seem to probably be true, at least in some cell types. But there's one group of researchers that argued in a very prestigious journal called Cell that, oh, wait, actually, the primary mechanism of action of the ketogenic diet on seizures is through the gut microbiome. And what they showed is that, you know, that they were all mouse studies, but they showed that the ketogenic diet, in fact, changes the gut microbiome, that they could take this gut microbiome from mice on ketogenic diets, transplant it into mice who were not following a ketogenic diet. And those mice that got the transplanted poop essentially had an anti-seizure effect just from changing the gut microbiome. Now, you know, for people familiar with gut microbiome research, it's all exciting and it's like the latest it thing. And but changing the gut microbiome probably won't have long-lasting effects if you don't change your diet and change your other lifestyle factors. Like we can transfer a gut microbiome to anyone, and that might change your microbiome for like a week or two. But if you're still eating the same diet that you're eating before, it's going to revert right back to what it was before. I mean, it's not like changing the gut microbiome is going to be a magic bullet cure. It might be helpful in some cases to kind of jumpstart the process, but it's not going to be a magic bullet, I don't think.
Yeah. Well, yeah, I've seen some studies about that as well. So it's really good stuff. And so one of the questions I have is that, you know, through you know, the studies on seizure disorders, and specifically they have some some groups that support the community, Matthew Friends and Charlie Foundation, and you know, they have found for sure that ketogenic diets have helped individuals. And you know, personally, I have clinical experience, you know, cases where actually the neurology group sent patients to me in town because they knew that I put patients on ketogenic diets as one of our therapeutic choices, although they tell the patients it's really hard and it's almost impossible to do. But what we see is that seizures threshold increases. So, you know, the auras decrease, the number of seizures decrease, and we see that over and over again. And, you know, I think through these foundations, we've actually seen that in addition to helping seizures, it's helped patients with the metabolic syndrome. And so I like how you say the problem is inflammation in the brain. You know, I would almost say that it's metabolic syndrome in the brain that we're experiencing. And so, you know, the question is, can you translate what they're doing with seizure disorders over to, you know, addressing metabolic disease?
Yeah, you mean mental disease or mental disorders or I mean, certainly there's a
it's funny. It's kind of a blur. Like mental health is metabolic health.
It is. So
yeah.
that is absolutely the theme of my book. There's no question about it. I think that, you know, the diet that we're using, sometimes there are differences between an anti-seizure diet and a diet for weight loss or a diet for type 2 diabetes, even though they're all typically low in carbohydrates. Some of them will be more restrictive on protein or how much fat they're recommending or other, kind of macro issues. But yeah, I think, one of the beautiful things about using metabolic treatments for all of these different disorders, so you're not just treating one disorder. It's not the whack-a-mole that modern medicine is right now. Modern medicine is whack-a-mole. It's, if you go to your endocrinologist for your diabetes, they're going to whack the mole that is your blood glucose, and they're going to give you medicines or insulin or something else to try to bring your insulin, or bring your glucose levels down. Usually your insulin goes up. But then that might make your bipolar disorder worse, or that might make you gain more weight, or that might make you more depressed. But they don't care about that because they're just whacking one mole. And then you're going to your weight loss doctor or your primary care doc who says, you've got to lose some weight. But since you're already on a medication for, say you're taking insulin, well, that's going to really make it an uphill battle for you to lose weight while you're taking insulin. And now your bipolar disorder is getting worse. So now your psychiatrist is going to put you on your bipolar meds. Guess what? They make insulin resistance even worse, and they make you gain even more weight. So now your diabetes doctor is saying, oh, now we got to go up on your insulin. And now your weight loss doctor is saying, what's going on here? You're losing ground. You're not making. When we use a metabolic approach, a comprehensive metabolic approach to all of these disorders, we can get all of those disorders better at the same time. And we can save the healthcare system a lot of money. But more importantly than saving money, we can prevent human suffering. We can restore health and happiness to lots of human beings who, everybody says, oh, these are unsustainable. I don't know. What is health worth to a human being? I deal with people who are desperate for better answers. And although a lot of people say, oh, the ketogenic diet is not sustainable, I'm getting patients with schizophrenia to sustain this diet and lose 160 pounds and keep it off. So I don't know what's wrong with all of you that you or all these other people who can't seem to get normal, ordinary people to do a diet, but I can get very ill people to do this diet and stick with it. Because when you give people accurate, helpful, motivating information, they really do want to improve their lives. They want to feel better. They want to improve their health. And we need to empower them. We need to recognize that, yes, you're capable of doing this. Maybe it'll take some time. Maybe you'll fall off the wagon a few times. That's okay. We're not going to judge you. We're not going to get angry that you fell off the wagon. We're not going to say, oh, see, this is unsustainable. You had a cookie. Oh, clearly this is unsustainable. We're going to say, okay, you had a cookie. No big deal. Let's talk about getting back on the diet. Let's do it. Because you're going to be better off if we get you better.
So I love it, Chris. We speak the same language. We get it. And our goal is to empower patients. And, I have a funny way to express how healthcare is compartmentalized. Like you said, it's all whack-a-mole. And so my little thing that I get a chuckle out of is I say, you go to the endocrinologist, he's worried about diabetes, so he tells you to stop eating sugar and carbohydrate. You go to the cardiologist, he's worried about your heart, he tells you to stop eating fat. You go to the nephrologist, the kidney doctor, he's worried about kidneys, so he tells you to cut out your protein. And you put that all together and you just don't eat forever and you're going to be healthy. But I think I have to add a fourth thing to it. And then this patient who's told not to eat anything goes to the psychiatrist and he says, just take all these medications and, we're going to make all the other problems worse. So, yeah, it is frustrating the way that healthcare is so compartmentalized, but, it's our job to educate healthcare professionals. And, you and I both, I've been at it for, over 30 years. And, I'm happy. I enjoy coming to work and seeing patients every day and educating my patients, educating healthcare professionals, educating and to teach everyone how nutrition can be a powerful tool.
Yeah, no, it's awesome.
So, we have just a couple minutes left, and you kind of had a segue into your book, and we'd love to hear just a little teaser about your book, Brain Energy, that's supposed to come out in the fall.
Yes, so it's coming out in November, but if people see this before then, it's available for pre-order even now. Brain Energy is really a synopsis of all of the research I've been doing over the last 6 years. I started out writing a book on the ketogenic diet in psychiatry and quickly realized nobody's going to believe this. It's just not going to go anywhere. I need to go deeper. I need to do deeper dive into the science. And to my shock and amazement, when I did the deeper dive in the science, I ended up connecting the dots of mental illness. And so my book is kind of a tour through what I call the metabolic and mitochondrial theory of mental illness. And I am arguing that all mental disorders are metabolic disorders of the brain. And that we can use effective metabolic interventions like diet, exercise, sleep, and other things to improve metabolic brain function and thereby reverse mental disorders that right now a lot of people think are permanent, lifelong disorders. For better or worse, the book is a science book. I go into a broad range of science, from clinical, epidemiological, but all the way down to the level of the cell, to try to help people understand what exactly is happening in the brain at a metabolic level that would cause mental symptoms. But more importantly, what can we do to try to help? What can we do to try to reverse this? And it is written for a lay audience. I use tons of analogies. I try to make it as simple as possible, but it does include science because I want to upend the entire mental health field. And I knew that in order to do that, I would have to come fully prepared with lots of evidence published in leading journals. And in some ways, although I do think this is revolutionary and has the ability to transform the mental health field, it's not a speculative theory. A lot of times people use the word theory in place of speculation. Like, I have a theory about what you're thinking. Well, no, you really have a speculation about what you're thinking. This theory is basically integrating decades of existing clinical and neuroscience. And it's taking all of the evidence that we have and it's connecting the dots of mental illness.
That's great, Chris. I would say that the book is full of mechanisms, hypotheses, case studies, and you definitely have to bring that book along with you in February, because I know lots of our audience will want to get a hold of it. And I guess the book would be a segue to more research.
Thank you. Yes, it will.
Great, Chris. Well, one last question for you is I like to ask our speakers is, what do you enjoy about going to these conferences, the summits, events, and speaking in person?
There are lots of things that I enjoy about it. Probably the number one thing, though, is just meeting all the people. It is always kind of invigorating because I get to hear people's success stories, but I also get to talk to people who maybe go to the conference for the very first time and they're just looking for information about how can I improve my weight, or how can I improve my diabetes, or hopefully how can I improve my mental health using some of these metabolic strategies. And it's an opportunity to kind of share knowledge and share encouragement and excitement, and hopefully get them connected with the rest of the audience. And so that it's a community of people supporting each other.
Oh, that's great, Chris. Well, I know we first met at the Metabolic Health Summit a few months ago, and just to tell our audience, this guy is bouncing off the walls. He has so much energy. He probably strapped him down to the strapped himself to the seat here today for this the podcast. But we wish you the best, and that you can really change the world of psychiatry.
Thank you so much.
So, how can our audience find out more about you, Chris?
Best place is to either go to my website, chrispalmermd.com. Or if you're on social media, I'm probably most active on Twitter, so you can follow me at Chris Palmer MD, and those would be two really good ways. So hopefully within a month, we're going to have a new website up, brainenergy.com, that's going to have a lot more information on the metabolic theory of mental illness. But for now, chrispalmermd.com.
Great, Chris. Well, we look forward to having you at the conference again in February. And for anybody that's interested in the conference, please visit lowcarbconferences.com. So that's all for now. And until next time, we'll see you then. Thanks, Chris.
Thank you, Jeff.